Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Ciclesonide. Its brand name is Omnaris. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Ciclesonide. We'll then touch on examples of dosing and finish it off with side effects. I put together some slides to go over this information, so let's jump into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So the main point to get across with this medication in terms of mechanism of action would be that corticosteroids have been shown to have a wide range of effects on multiple cell types, including mast cells, eosinophils and neutrophils, etc., and mediators, so histamine and cytokines, etc., involved in allergic inflammation. In terms of indications or reasons we prescribe this medication to a patient, well, we may see this medication prescribed in the treatment of asthma, as well as allergic rhinitis. With respect to contraindications or reasons we would not be able to prescribe Ciclesonide, well, first off, we wouldn't give this medication to a patient who had a hypersensitivity to Ciclesonide or any other component of the formulation. Lastly here, we wouldn't use this medication as primary treatment of status asthmaticus or other acute episodes of asthma requiring intensive intervention. Now for an example of dosing with Ciclesonide. So in the treatment of asthma, using the brand name Alvesco, and the patient having previous bronchodilator use, we may see an initial dose of 80 micrograms inhaled orally twice daily. The maximum dose would be 160 micrograms inhalation twice daily. For allergic rhinitis, using the brand name Omnaris, we may see 2 sprays, being 50 micrograms per spray, in each nostril once daily. The maximum dose would be 200 micrograms. As with all medications, there are some side effects or adverse reactions that patients may experience while using Ciclesonide, so we'll go over some of those here now. Some common side effects may include arthralgia or joint pain, coming in at 3.5%. 3% of patients may experience back pain, and 3 to 11% may experience a headache. Otalgia may happen 2% of the time, and 11.5% of patients may experience bleeding from the nose. Nasal congestion comes in at a rate of 2 to 6%, and pain in the throat at 2.5 to 5%. Sinusitis may occur 3% to 5% of patients, 5.5% of patients, and some patients may experience pain in the extremity. This may happen up to 3% of the time. Some serious side effects may include adrenal insufficiency, bronchospasm, or an exacerbation of asthma. This may happen 6% of the time. Alright everybody, that's all we're going to talk about today with Ciclesonide or Omnaris. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. There's also some links in the description you can check it as well. That's it for today. Take care.